pharmacological treatment of adult ADHD in Europe. It's a study about the medications for treating ADHD. Actually, ADHD is a chronic condition that affects every single aspect of life and puts a severe burden on the family and on the patient and his family and his partner. It was believed before that symptoms of ADHD just fade away as the child grows up. And it was believed that it was only a children's disorder. But actually, it was proven that 60% of the children diagnosed with ADHD, the symptoms continues in the adulthood. The prevalence of the prevalence of the ADHD in children in Europe, according to our study, is 6 to 9%. And also the study stated that in developed countries, it's much higher than developing countries. In the developed countries, it's 4.2%, the prevalence of ADHD, and 1.9% in the developing countries. In addition to the core symptoms of the ADHD, as my colleague Carol stated, that the core symptoms are inattention, difficulty to pay attention, and impulsivity and hyperactivity. In adulthood, some other symptoms appeared, like emotional dysregulation and general organization in the daily tasks, in the daily life tasks, and difficulty in the temper control, problems concerning temper control, and stress intolerance. They can't bear stress by any means. Unfortunately, ADHD is comorbid with some disorders, which make it a clinical challenge for the therapist to diagnose and treat ADHD. Like mood disorder, anxiety disorder, substance abuse disorder, and personality disorders, which is really difficult for the therapist to diagnose the ADHD correctly and treat it, while comorbidity exists with these disorders. Effects on children, on adults, differs from the effects on children. And our study talks more about the effects on adults. Effects on adults on patients with ADHD, such as STDs, sexually transmitted disease, very high percentage of sexually transmitted disease. Unwanted pregnancy was very high as well in patients with ADHD. ADHD thought to be, patients with ADHD showed to be underachieved academically. And they also low percentage of full-time jobs, low percentage of income was proven, very high in changing jobs, very high in accidents and injuries, and difficulty in following rules and social norms. Also percentage of traffic violation and speeding and driving drunk was very high in patients with ADHD, reckless driving in general. And that costs the healthcare system a lot of money every year. That's why it should be taken into consideration and should be taken seriously how to treat and handle this problem, this chronic problem of. And actually, it became epidemic recently. So we should be focused on it. Then the study, the main point of the study, that the stimulus medications was proven to be the most effective in treating ADHD, with 70% respondent rate for the first medicine that's given to the patient. And if the patient didn't respond to the first medicine, 90% usually respond to the second medicine. And the dosage of this stimulants medication is 1 milligram daily per kilogram of the patient's weight. But unfortunately, due to the comorbidity of the ADHD with the mood disorders and substance abuse disorder, and especially depression, it was dangerous to give stimulant medication to a patient who suffers from depression and substance abuse disorder. That's why non-stimulant medications were studied, and it's been proven that it was effective as well, but not at the stimulant. So it's the second option after the stimulants. And then our study concluded that more trained and experienced therapists are needed to treat ADHD, as well as research on non-pharmacological treatments are needed, like cognitive behavior therapy and psychotherapy. More research are needed on this area to help those in need with treatment of ADHD.